Hi, my name is Dr. Dino Pappas. I'm with the Center for Integrated Medicine. This video weblog will actually be on pain medication, the abundance of prescription pain medication in our society. I'm going to read to you a couple different pieces of information that I think may be of interest to you. This is basically stemming from a CDC, Center for Disease Control, report that was released on the 1st of November, a couple days ago. The director of the CDC himself said we are in the midst of an epidemic of prescription narcotic overdose. Further goes in the report to outline the extent of the abuse. There's been a threefold increase over the past decade of prescription pain medication. In 2010 alone, there was enough painkillers prescribed to supply every American adult with a 1-month supply. Over the last decade, there's been a rise in pain medicine prescription by 50%. About 40 Americans die daily from complications of prescription pain medications. 80% of the prescription pain medications taken in the world are actually taken by Americans. Of that, 99% of the world's prescribed Vicodin and generic Vicodin was consumed by Americans, yet Americans only constitute about 5% of the world's population. One of the most popular prescription medications, therefore, is Vicodin, which is a pain medication drug. About $600 billion per year is lost. Productivity and medical expenditures are spent because of prescription pain medication abuse. Accidental overdoses for pain medication are more fatal than car accidents in about 17 states. Accidental overdoses are responsible for more deaths than crack in the 1980s and heroin in the 1970s. Approximately about 100 million Americans suffer from chronic pain. Yet, personally, I've never met anyone that suffered from a deficiency in Advil, Tylenol, Motrin, Aleve, Vicodin, Oxycontin, or any prescription pain medication. It's not possible. You're not deficient in any one of those. 600,000 doctors are licensed to prescribe pain medications. Of those, at the top of the abuse list are primary care doctors, dentists, and internal medicine physicians. The Surgeon General himself has said that there is a lack of understanding of when to prescribe pain medications. In fact, new recommendations now call for pain medications only to be prescribed in fatal or near-fatal conditions, conditions like cancer, severe trauma, and not for simple aches, pains, injuries, or procedures. So that being said, what do we do about this problem? What can we do about this issue? At the Center for Integrated Medicine, we offer conservative treatments for pain that involve things that constitute chiropractic care, soft tissue treatments, acupuncture, nutrition, and advice. Chiropractic treatments free joints from being restricted. That basically decreases pain. Soft tissue work frees up tight muscles. Tight muscles are often pain-producing muscles. So freeing those muscles decreases pain. Acupuncture bombards the brain and spinal cord with information that helps block pain from traveling to the brain. Encouragement basically encourages patients to move safely. If you move safely and with proper purpose, it can actually decrease pain, as many pain-producing problems are now motion-produced, like repetitive trauma injuries, like carpal tunnel, things of that nature. Low back injuries fit in that category as well. And nutrition. We offer nutrition that's safe, nutrition that can affect inflammation, nutrition that can affect pain, nutrition that can affect cramping, muscle spasms, and other things of that nature as well. So if you're interested in those things, please feel free to give us a call. Our office line is 708-532-2346, 708-532-2346. Our website is www.thecfim.com. We also want to mention that it's not just us at the Center for Integrated Medicine. It's also chiropractors across the United States, physical therapists across the United States, acupuncturists, nutritionists as well can also aid in your pain. You do not have to resort to pain medication because of the risks I just mentioned. Thanks, and your greatest wealth is your health.